welcome. You're watching FYI. I'm Rishika Barua. The vaccine is here and the world's biggest vaccination drive has been set in motion with the first trucks carrying the COVID-19 vaccine leaving the Serum Institute of India facility in Pune. India begins inoculation on the 16th of January, as we're all well aware. Healthcare workers and frontline workers will be the first to get it. But what does the world's biggest vaccination drive really look like? And more importantly, how will you get the vaccine? On FYI today, we look at how this vaccine is being transported, where it is being stored, and how you can enroll to get the jab. On the show today, we'll be joined by our team of reporters who are tracking this story from ground zero. We'll also be joined by a very interesting panel of experts who are directly involved in this process and those who will help us to make sense of it. So that's what we're going to look at today. But first, let's look at what the chain of transportation, is as far as the vaccine is concerned. So from the manufacturing facility, which in today's case we saw Serum Institute of India, it will go first to the closest airport, which was the Pune airport in today's case. From airports, this vaccine is being transported to 4 primary vaccine stores. Now, what are these primary stores? One is in Karnal, which is in Haryana, one is in Mumbai, one is in Chennai, and one is in Kolkata. So that essentially covers north, south, east, west of India. From these primary vaccine stores, then the vaccine is going to be sent to 37 state centers in refrigerated vans. Now, 37 state centers, well, each state has minimum 1 center, but there are some bigger states like Uttar Pradesh, which have as many as 9 centers. Now, from state vaccine stores, these vaccines will then be sent to the district vaccine stores. From the district stores, it will be finally sent to the primary healthcare centers where the vaccine will be distributed. Now, just for the benefit of our viewers, the Director General of Civil Aviation, which is the DGCA, has its own set of very comprehensive guidelines on how the transport of vaccine is going to happen on a bed of dry ice on board these aircrafts. As far as the trucks carrying the vaccines are concerned, they have their own SOPs that are in place. These are temperature controlled trucks that are GPS enabled and will be sounded, very interestingly, with an alarm every time the door of the truck is opened. But the million-dollar question, how are you going to get the vaccine? Well, you have to register on the CoWIN app. But just to clarify this, at the moment, the CoWIN app is not open to the common man. The CoWIN app so far is being used by primary healthcare workers. The CoWIN app is being used by government hospitals and by private hospitals to upload their data in order to enable the first phase of vaccination to roll out. The CoWIN app is not yet open to the common man to register, but as and when the CoWIN app opens, you register online, you get an OTP, you feed in your details, you upload your government identification document, and then you will be notified with an SMS on when and where you will get the vaccine. But let's get you a sense of what's happening on the ground. We'll be joined by Sukirti from Delhi. We have Sam Daniel, who is joining us from a state center where the vaccine is in fact being stored. Let me go across to you, Sam. Where are you at the moment and what do these centers look like? These state vaccination centers where the vaccine has now arrived, what does it look like?
Well, Rashika, I'm at the state vaccine store at Thenampet in Chennai, and it's like this, with many walk-in freezers inside, and each of these have hundreds of craters, each having around 12,000 doses stored. Just a couple of hours ago from here, we had vans leaving to 10 districts to begin with, the dispatch, and then from there, they will be serving to the surrounding districts, from where they will go to the primary health centers and other what they call last mile connectivity. Before 16th, all these places will be having enough stock of the vaccine. Tamil Nadu received 5.3 lakh doses, of which they're using 5.1 lakh, having 20,000 as a buffer stock. In terms of infrastructure, Tamil Nadu has a storage capacity of 10 crore doses, although they require 2 crore doses for regular when children are newborns or for inoculating newborns and for other things. They have an extra capacity of 8 crore. In fact, there are 51 such walk-in freezers across Tamil Nadu. And at the moment, Chennai gets the bulk of it, more than 1 lakh doses, and Coimbatore gets around 70,000 doses. And based on the feedback in terms of glitches and in terms of other difficulties, they have fixed all those, and they say the inoculation process will be completely uninterrupted, but still they're not taking any chances. They are having observers to make sure everything will fall in place. Tamil Nadu has got only 20,000 Covaxin vaccines, which is yet to clear the third phase of trial. But authorities say public will not have any choice. Whatever they get, they have to be administered. You may have doubts, you may have uncomfortable feeling, but authorities say there's no need for such doubts or questions, because public health experts with due diligence have approved both the vaccines. But still, the bulk of it is Covishield at the moment in Tamil Nadu, and it will begin on the 16th. At the moment, Tamil Nadu's active tally is around 8,000 with more than 8 lakh positive cases. In that sense, it's one step forward to make sure the citizens across the country and across the state here will be protected, to begin with the frontline workers from the 16th.
So that there behind Sam is what the state vaccine stall looks like. Remember, we've broken down the process for you. From the state, it goes to the district vaccine store, from where it is actually then distributed to the various healthcare facilities. Sukirti has been tracking the details of this story as well. Sukirti, the first batch of vaccines have arrived in New Delhi as well. What is this entire procedure? What does it entail? Break it down for our viewers.
Well, yes, the first batch of vaccines arrived to Delhi today. It landed at the Delhi airport at about 10 a.m. Around 1 p.m., the first truck of vaccines for Delhi, which was intended for Delhi, it left for the Rajiv Gandhi Super Speciality Hospital, which is in East Delhi. This is the main cold storage facility for storing vaccines in Delhi, and the police had already made arrangements. There was heavy police deployment, there were escort vehicles, a green corridor was created in order to ensure smooth movement of the transportation of the vaccines from the airport to the hospital. So they are currently stored at a 3-story facility in the Rajiv Gandhi Super Speciality Hospital. From here, in the next 2 to 3 days, it will be sent across to at least over 600 cold chain points across Delhi. So while the hospital is the main cold storage facility, there are also 600 other cold chain points where the vaccines will be stored. And then eventually, when on 16th of January, we will see the vaccine rollout, then there are at least 89 sites in Delhi where the vaccination will take place. These 89 sites will include both government as well as private hospitals. And at least 3 lakh healthcare workers in Delhi are set to get vaccinated in the first phase.
All right. Appreciate you, Sukirti and Sam, for joining us with that update from Ground Zero. So that's just to get you a sense of what really these facilities look like. What is the chain of transportation that is being followed? We are joined by an extremely interesting panel of experts who will help us understand this process better. We have Mayur Shetty, who's the CEO and product architect of Black Frog Technologies Private Limited. Now, this is a government-funded startup that's looking at how medical-grade refrigeration systems can address the last-mile problem that is associated with the delivery of vaccines. So that's a very crucial question that we'll ask you. Dr. Rakesh Mishra, the director of the Center of Cellular and Microbiology, joins us from Hyderabad. Dr. Saranjit Chatterjee, senior consultant at the Apollo Hospitals, and Kunal Agarwal, the co-founder and director of CoolX Cold Chain Private Limited. You might have read that CoolX name today if you were following those visuals very closely of the vaccine trucks that rolled out of the Serum Institute. So, Kunal Agarwal, I want to begin by asking you, these trucks that are going to be transporting the vaccine from point A to point B, and several of that in the transportation chain is actually going to happen by road. What are the features of this truck that's carrying the vaccine?
Hi, Rishika. A pleasure to be here on NDTV. Well, these trucks are actually, we've been doing this business since a decade, and these trucks are very, very highly tech-enabled. For example, each truck has got a range, a temperature range of going from -25 to +25. So we can set the range at any temperature that we want and carry any sort of vaccine, even the -21 or the 2 to 8 degree one that we're carrying right now. So everything is possible in these trucks. These trucks also have door alerts, so that if anybody opens the door, any unauthorized opening of the doors, our central cell that is tracking the trucks gets the information right away, and corrective action can be taken. Apart from that, we also have live temperature tracking in all these trucks, and each truck is tracked live, and we are getting live temperature feeds from every location in India. And of course, these trucks also are GPS enabled, so we can track them anywhere we want. So we currently have a fleet of around 400 trucks which do this, and we have been carrying all sorts of vaccines through the last decade for lots of our pharmaceutical clients. and Serum has added the COVID vaccine to its product portfolio now. So we've already been doing a lot of work with Serum. So this is just a new product for us.
All right. So you've already been doing a lot of vaccine transportation, and this is just a new project. Except that this project is really extensive. It is the world's largest vaccination drive, and I want to come to you, Mayur Shetty, because you're dealing with the crucial question of last mile connectivity, and I think that's going to be the biggest challenge that sort of differentiates what India's challenges are in terms of vaccine dissemination as opposed to countries around the world. What do you foresee, Mayur Shetty, as some of the big challenges in order for this vaccine to reach, the far-flung areas in the country?
Yeah, that's right, Rishika. The vaccines are here, and it's wonderful news that the scientific community, manufacturers, government agencies, and the entire ecosystem has lived up to the promise. Like we just heard, they come in high-end refrigerators and with good power supply and some cutting-edge technology in trucks as well, which now leaves just the last mile transport and the delivery issues, which has been largely unaddressed. We still use crude forms of non-compliant systems like ice packs or gel packs in plastic boxes, which end up dropping temperatures below 0 degrees Celsius and rendering free sensitive vaccines unviable, or they go above 8 degrees Celsius as they melt in the upcoming summers. And this usually goes unnoticed. So in a nutshell, I wouldn't be comfortable to take a vaccine that came to me in an ice box, because the whole issue with getting both shots of the vaccine is that we are going to get complacent now and believe things are back to 2019 while I head out to parks and restaurants without caution, while in fact I'm putting myself at greater risk of catching the disease.
Yes.
Right? So, and the worst part of it is that very few people are aware of the risks of poor cold chain. It's likely that one gets a vaccine which had lost its potency on the way, and then a week later end up contracting the disease anyway, and he will blame the vaccine, claiming the vaccine itself gave me the disease.
Mayur Shetty, if I can then understand, because you highlight a very important problem, and we'll get the medical experts to address that as well in just a moment. But how do we combat that problem? You're saying that if anything in this entire chain, this entire transportation chain were to not work at any juncture, you're saying that the vaccine could end up being unviable for the person who's receiving it. What are the safeguards that have been put in place to combat that?
Yeah, I mean, so far we've not had any alternatives to portable medical grade refrigeration. It's been a thermodynamics issue, and that's kind of where we come in right now. These are some sociological problems we've learned during vaccine-derived polio as well. Absurd conspiracy theories around inefficacious vaccines being administered. And these pose some very serious problems because they erode the government of India's painfully built up confidence in people in the process of immunization.
Right.
And our work has been in delivering efficacious vaccines with a portable medical grade refrigeration system that is ergonomic, fits into a backpack. It carries 300 to 400 vials. 300 to 400 doses, about 30 to 40 vials, which means you can administer about, it's meant for day-long transport of vaccines. So you can reach some of the farthest corners without risking that your vaccines are going to waste.
Okay. Dr. Rakesh Mishra, just break it down for our viewers from a medical point of view. How crucial it is for every, chain to work, for every cog in the wheel to do its job, for every temperature to be maintained to the optimum level. How crucial is it, and how dangerous can it be if it's not, if something down, this chain falters?
Yeah, so you heard that the vaccine needs to be transported in 2 to 8 degree, which I think is fairly doable, and India has experience of handling vaccine at this temperature. It's not like mRNA vaccines which require extraordinary situation of -40 or -70, depending upon which one we are talking. And it is true that even past, it has been a situation sometimes that cold chain is not maintained and the vaccine becomes inactive. Even if for a short period of time it is room temperature. Room temperature in all places can be very high sometimes. So it is very important to maintain the cold chain. But I think there are technologies now, there are boxes which kind of indicate whether temperature has gone up or not. And that should be taken care, because for a few minutes it's okay. But if the box is not in is more than 8 degrees for a couple of hours, we might lose the activity. And that will be very, very dangerous thing, because remember, these are emergency use vaccines.
Yes.
So we have to follow up the patients and see what is the efficacy of this in the real population, and that is the data which will be useful for further approval of these vaccines for commercial
Right.
and large scale usage and even for export for other countries.
Okay.
So it's very important that the cold chain is very strictly maintained and monitored. But I think since so much of dry run, so much of practice has been
Yes.
done, and in beginning at least receivers are healthcare workers who are well informed and well educated for this.
Yes, that's the other big question that I want to address. Dr. Suranjit Chatterjee, in your experience, how crucial is the role of the vaccination officers? Remember, there are 5 vaccination officers at each vaccine center that have been deployed. How crucial is their role to identify whether or not the vaccine that has arrived has been maintained at the optimum temperature and is in a condition where it can be administered? And are they equipped to do that?
See, India has been doing this type of vaccination for so many years. They are all very well trained, and this time the government has been really proactive from before. So I'm obviously expecting, and I know for sure that this has all been done, but is that they play a very important role because they have been trained to find out what type of vaccine is reaching them, as the cold chain, whether they has been maintained or not. Once they have ensured that all the SOPs have been followed, then only the vaccine is effective, because it can be a big, suppose a vaccine which has not been, where the cold chain has not been maintained, and that vaccine is given to people can develop the infection, and then the vaccine is blamed for it, as was being told earlier. So people lose confidence in the vaccine. So that's why it's very important that these people do their work properly. But as I'm saying, that we have seen this vaccination programs for years to happen. It has happened with polio. It has happened with so other things. In India has been really experienced. Indian vaccinators have been experienced. And the SOPs, if the SOPs are followed correctly, all these things won't happen. And I'm sure that this is going to work out in the case of COVID this time.
No, but you're saying that the healthcare professionals on the ground who are finally going to be administering these vaccines are equipped with that information? They can identify any red flags?
They can, because once the SOPs are followed, they see what charge of a change, whether there is any change in the color, whether there is any change in the temperature. Okay. So once the SOPs are followed, they can identify. But yes, if the chain has been broken somewhere, then it could sometimes create a problem.
Okay. So this chain of transportation is extremely crucial, and we've tried to sort of break down what happens from when the vaccine actually leaves the manufacturing unit to when it reaches the healthcare facility. We've tried to break down that entire process for our viewers. That's essentially what's going to be happening in the coming few days. But what happens, if there is any kind of a red flag in this process? What happens if one of the criteria is not met, the temperature is not met? What are the safeguard mechanisms? That's what we're going to talk about on the other side of a very short break. Our team of experts will be live with us. Stay tuned. Welcome back. You're watching FII. We're talking about how the COVID-19 vaccine is going to reach you. What is this mammoth vaccination drive all about? And I want to talk about, towards the fag end of the show, I want to talk about what is the contingency plan, what are the kind of safeguard mechanisms that have been put in place to avert any untoward incident in this entire chain. Kunal Agarwal, to you first. You're the man who's running those container trucks out of the Serum Institute today. What are the contingency plans that have been put in place as safeguard mechanisms to ensure nothing goes wrong?
Well, first of all, we're in the business of zero tolerance. So there is no question of a broken cold chain anywhere. As the experts on the panel mentioned that, any loss of temperature anywhere or any temperature excursion leads to ultimately, loss of efficacy or potency of the medicine or the vaccine or whatever we are carrying. So as an end-to-end logistics solutions provider of cold chain solutions, we've been into this business as far as addressing the last mile is concerned, as well as secondary transport. So we're very well equipped to do that. As far as the contingencies are concerned, there are lots of contingency plans that we have in place. Fortunately, we've never had to use them so far, but if at all that happens, we have standby vehicles at every 30 kilometers in the country, ready to deploy at the drop of a hat.
Okay, so you have standby vehicles every 30 kilometers in the country. God forbid if there were to be an untoward situation. Mayur Shetty, what are the safeguard mechanisms? You have those last mile connectivity backpacks that carry vaccine vials. What are your safeguard mechanisms?
Right, there's 100% accountability that we're assuring. So it's not just cold chain while we are guaranteeing that your vaccines are going to come to you in a safe condition. The health authorities are getting continuous data. They're completely fully aware of live vital statistics like the location, the temperature, what areas are being immunized, who's being left out, who's getting vaccines. Moving ahead with support from Government of India, we're actually building up a newer traceability system as well for advanced monitoring of vaccines with vaccine vial traceability of kind of figuring out who is getting which vaccine from which manufacturer, which batch, which lot. So end-to-end traceability in terms of online monitoring is something that we're working on right now.
All right. And Dr. Rakesh Mishra, how important are some of these measures that both Kunal Agarwal and Mayur Shetty have just talked about?
Oh, these are very crucial things. You must know which vaccine first dose person was given. So second time the same vaccine should be given at the second dose. It can't be something else. And people are moving. So I'm sure with the electronic system of monitoring and creating the database, these are the things that will come in handy. It's very important to have. First, as you just, it was very reassuring to see that the stakeholders are so confident. That really makes us feel good. And monitoring of who is getting which vaccine is getting, so that they can go to another city after 1 month, 1.5 months, and they can get the same vaccine second dose. So those things should be enabled. And it is big exercise. It is very challenging. But remember, we are the IT power in the world, and we have been handling such large-scale things every few years for various elections and many other things. So I think, and now people are sensitive, people understand the importance, and we will also know that the first batch is very informed people, second batch will be again frontline workers.
Yes.
So by the time general public starts to come, 50 plus and other criteria, by then we will have lots of experience and mastered many.
But Dr. Chatterjee, if I can bring you in here, it's also very important for viewers to understand that this is an intramuscular vaccine. So only a trained professional can actually administer this vaccine. Is that correct?
Yeah. Intramuscular injections. Intramuscular injection, obviously you need trained people, because sometimes if you get into a small vessel or a nerve, then it can really affect it. So it is obviously there people who are trained to give injections can only give vaccinations. This could be basically people have to be trained. It's not a rocket science.
Right.
Just the people have to be trained as to where to give it, how much to give it. Then it's more than enough. Most of the people, when we began our training, or the nurses begin their training, we are taught how to give injections. So it's a very basic thing, but has to be given correctly anyway.
All right. Well, gentlemen, this conversation has been very interesting and very reassuring, to say the least. There are so many different safeguard mechanisms, technicalities that are involved as far as this vaccine transportation process is concerned. And it's been fascinating to hear some of those details from you. Thanks so much for joining me on this edition of FYI. I hope you enjoyed watching it too. Thanks so much.